Namaskar viewers, hello and welcome to Sansad TV. I'm Tina Jha, you're watching Perspective. The World Health Organization has declared monkeypox as a global health emergency. More than 16,000 cases have so far been reported from as many as 75 countries. India has until now reported 4 cases. The 4th one has been detected in the national capital. A 34-year-old man with no history of travel to countries affected by the disease has tested positive, unlike the first 3 cases that were reported from Kerala. That particularly has been concerning, prompting the centre to hold a high-level review meeting. Union Health Secretary, Directorate General of Health Services, also the Director of National Centre for Disease Control, held an urgent meeting with the Joint Monitoring Group. All states and union territories have now been advised to undertake close surveillance. So what is causing monkeypox? How does it spread? What are its symptoms? And what can you and I do to protect ourselves from this disease, which is now spreading rapidly across countries? We'll try and find answers to all these emerging questions about monkeypox from experts who are joining us on the program. Pleasure to welcome Professor N.K. Ganguly, former Director General, Indian Council of Medical Research. Thank you for your time, Professor. Also delighted to welcome Dr. Puneet Mishra, Professor, Centre for Community Medicine, All India Institute of Medical Sciences. Professor, thank you for your time. Welcome to Sansad TV. And Dr. K.D. Burman, Director, Professor, Department of Dermatology, Maulana Azad Medical College. Thank you, gentlemen, for joining us on the program. In fact, on this special edition where we're talking about the monkeypox scare and the kind of precautions that we all must take in the wake of this health scare. Professor Ganguly, let me begin the program today with you by understanding what exactly is monkeypox. Is it a new disease that the world is now grappling with?
Monkeypox belongs to a family of orthopox virus. This was here for many years. We knew about it in a low-grade transmission. All have happened in African country, Western African, Eastern African country, but it has spread very widely now among some of the European countries, United States, Canada, and now 74 to 75 countries have it, and 1,700 cases have been reported till date. And as you said, 4 in India, 3 from Kerala, and 1 for. And it was reported in early July, and 14 July, Indian case was reported. It is found in the form of like any other viral infection, with malaria, with fever, and redness of eyes, body ache, backache, muscle thing, marasma, the toxic symptoms which happens after viruses, and then there are rashes, and the rashes are exactly as the pox viruses happen. They happen in the arms, faces, and the palm at first, and then in the legs and the soul, and then in the body, in the form of vacuoles, pustules, etc. Then there is a scab formation, and it goes off. It spreads from the animals to humans. So animal contact need to be avoided. And those who are traveling from particularly the African countries, and there where the cases, and those who are reporting sick with rashes, etc., one has to be careful and avoid contact. It also passes on through fomites like bed sheets and others, and contact, but respiratory transmission is also possible. And if you have been in contact at least 21 days, you need to be followed. And at this time, there are 5 companies in the United States which are providing a diagnostic test. It is a PCR or RT-PCR test system. And there is one drug, which is Decrovitavir, which is approved by US FDA. And there is one vaccine particularly for this, which is a Linneos, and which is done by Nordic and others. So these are some. There is an SOP which the WHO has given, and there is an SOP which the government of India has also given.
Okay, so what these SOPs are, what the guidelines have been issued by the center and also the World Health Organization is something that I'll come back to you and understand, Professor Ganguly. But in the meanwhile, let me go across to Dr. Mishra and try and understand what is causing the spread, the fast spread of monkeypox globally. Dr. Mishra, the Director General of the World Health Organization, while declaring monkeypox a public health emergency of international concern, indicated that it could be a sexually transmitted disease. But looking at the manner in which it's spreading, more than 16,000 cases in as many as 75 countries, does it look like it's just an STD?
First of all, we should look at how it is transmitting because this is not a new disease. This was present in African countries for many years, and there were sporadic cases here and there. As we know, we have enough knowledge about the mode of transmission. What we know right now, the disease, it is spread through close contact. It is spread through droplet infections. So if there is close contact, whether it is sexual or otherwise, yes, this disease can spread. But it's not totally spreading through sexual contact, as I mean, it's not a STD in that sense, but yes, it can, because if a person who has a disease and there is a close skin-to-skin contact, yes, disease may spread. So in that sense, but no, what I'd say, there are many other modes of transmission. Say if you are in close contact with the individual, you have you can get through fomites, you can get it through droplets. Suppose a person who is sick using some kind of bed or anything, and the other person who is okay comes in contact with that, yes, it can spread. So there are many different modes of transmission. I would not say that it is only sexually transmitted. Sexually transmitted disease, yes, it may be one mode, but not solely it's a STD.
Okay, so let me go across to Dr. Burman and understand from him about the characteristics of this, disease that has a fast spread across several countries. Dr. Burman, looking at the images, it appears that skin lesions, are one of the main and the unique characteristics of monkeypox. Help us and our viewers understand how do these skin lesions develop? Are they painful? And how much time does it take to recover?
Basically, it's like variants of the pox. So it's almost, you can say, like some of the features are similar to the smallpox. See, here the characteristic is after a fever, 1 to 3 days after the fevers, you will have a skin lesions, which is initially it will start as a basic, macular rash, that is red patches. Then followed by it will develop vesicles. Basically, it's a vesicles. Then it will develop the bigger size, and basically it will develop a umbilicated type of lesions. Basically, you can have umbilications. So it is different from the chickenpox. Chickenpox's lesions is more superficial, and the monkeypox lesions is deep-seated. That's why you have a more tense, and somewhere you can have umbilications. So, and gradually these lesions will become pustules. That means this lesion will contain a pus, then gradually it will fade out and develop a crust, and this takes usually 2 to 4 weeks. And once the crust is off, the patient is okay. So basically, till the crust patient has, till that time patient is infected.
Dr. Mishra, the fact that, there have also been some deaths across several countries as of now, even though the death rate is quite low, but nevertheless, there have been deaths because of monkeypox, and that's quite concerning. Help us understand what is, about the diagnosis. How does one know that he or she has been affected by monkeypox?
The diagnosis is, sometimes it may be very difficult, and sometimes you may confuse with other skin infections. Like even sometimes you may confuse with bacterial infections, folliculitis. You may confuse with that. May be confused with chickenpox. May be confused with some other skin lesions, other viral skin lesions. So one has to be careful while examining the lesions. So this basically, as I already mentioned, is umbilicated lesions, and after the fevers, and more commonly this will be associated with the lymphadenopathy. Lymph nodes means you will have generalized lymphadenopathy in these cases. This is a more important. Along with that, you will have fever for a few days, and these lesions may be itchy, in fact. But see, these all are theoretical knowledge. But whatever we experience in our hospital, like one patient is admitted in our hospital, we all know. See, that patient is totally fine right now.
Okay, coming
So
to the
basically,
other
it's a milder
aspect,
form.
Dr. Mishra, so, this was about how it impacts the skin, but do we know, does monkeypox also affect the other organs of the human body?
Yes, of course, it can affect. You're talking about the death and about the symptoms. Let me start from there. Death rate is somewhere from 0 to 11% in different regions. That's what we know. Regarding symptoms, the symptoms usually first there's a lymphadenopathy, as Dr. Burman has said. There is a fever. There may be rash afterwards, and it simulates with many other races. It may be umbilicated, as he has said, and there is a quite similar to other kind of races. But the specific feature here is usually patients first present with the fever and lymphadenopathy. So what is lymphadenopathy? It is a swelling lymph gland, right? So that patient may complain of along with the fever. Then there may be rashes, red eye. There may be other complications. The patient may, because of skin, there may be cellulitis. There may be other things. Then other organs like lungs may be affected. There might be pneumonia. Those who are immunocompromised, they might have other symptoms. It might affect if there are these lesions on the eye. The vision may be affected. So other body organs might get affected in this disease as well.
Okay, Professor Ganguly, now talking about the SOPs and the guidelines and how prepared are we in dealing with this scare, particularly because, 4 cases until now, the 4th one with no travel history to any of these affected countries. How are we ensuring that this does not become a scare for us?
One of the major things is surveillance, particularly surveillance from the areas from which the subjects are coming to the other areas. So essentially, these they spread through the travel, and as well as some clusters are also fine. You were asking that whether it is sexually transmitted disease. In the MSMEs, the men having sex with men, it is very high, and particularly in Europe and United States and Canada, this is one of the largest groups which has been affected. So safe practices, surveillance, very strong surveillance, looking at the animal contacts, and those who have come in contact, they need to be vaccinated, although mass vaccination has not been recommended. And those, when you get monkeypox, then now there is a US FDA based drug which can be given. That is known as tecovirimat, and this can be given, and this actually reduces the spread of the virus drastically. In serious cases, when there is a hemorrhagic manifestation, or there is encephalitis, or in the eczema where there is a florid manifestation, you give also the immunoglobulin, which is hyperimmune immunoglobulin, which prevents it. There are some smallpox, new smallpox drugs, which could also be given, but now for specifically for monkeypox, there is a drug. And unfortunately, in India, we do not have this vaccine. The vaccine has been stockpiled by there's only one company which made it, that is Nordic, and this has been stockpiled in the United States as well as in Europe. In India, 15 centers ICMR has activated for the diagnosis, which is spread around the country, as well as surveillance. And both WHO as well as India guidelines have said that mount surveillance, there are signatures in the serum which provides the same way as for the COVID and others with appropriate modeling, indication that whether this is spreading or not. But at this moment, there is no fear. In Kerala, most of them had a travel history.
Yes.
The Delhi case doesn't have a travel history, but one cannot rule out whether he has a contact history with someone who might have traveled or who might have got early symptoms. So
Absolutely.
we need to have those who are particularly having fever or sick and others, they're traveling or they're in your vicinity. We should be careful and we should reduce contact with them as far as possible. The C95 mask is recommended if you have somebody around you, and appropriate hygienic conditions, the washing of hands, etc., sanitization, all of these are recommended.
Okay, Dr. Mishra, is there any evidence to suggest, because there have been cases across 75 countries, is there any study, any evidence that suggests who is this, which group of people is monkeypox largely affecting?
Okay, very important question. And but before going deep into it, let me start. I mean, why it is? There are many theories why now it is affecting so many people. We know that till late 70s, we used to give a smallpox vaccine. And the smallpox vaccine, it was somehow getting, those individuals, they were getting protected from monkeypox as well. Now, all those people, those who were born at that time and got the vaccine, they are in their 40s or so. All those people who are little younger, they are not vaccinated for the smallpox. They are more susceptible. Now, regarding the disease, who can get the disease? Yes, those who come in the close contact with any case, yes, they would develop the disease. But the question here is, who would get the severe disease? Because if it is a mild disease, it is not that much of concern. But who would get the severe disease? What have been seen that the children, they might get the severe disease. Those who are immunocompromised, they might get the severe disease. So these group of people, they should be protected. They should take the extra precaution. Again, the individuals who come in the contact with the wild animals, right? That's how it is spread in the Africa and other countries. So they should take the special precaution. Healthcare workers, they should take the extra precaution. And wherever the disease is present, and if somebody is symptomatic, and those who are coming in contact with those individuals should take the extra precaution. That's why it has been recommended that those, because there are certain vaccines which have effective against this disease, but we do not recommend at this stage any mass vaccination. I mean, from epidemiological point of view or from public health point of view, we don't recommend that because we know it is not needed at this point. However, those who are at high risk, the healthcare personnel or those individuals, they should be given based on the case-to-case basis and based on the situation in that particular country and availability, because the vaccine which is available is very limited. It's very limited supply, and very few countries, they have some kind of stock of this vaccine. The other thing which we have to keep in mind, because most of the people, they are very much worried, because in very recent past we have seen the COVID. And this has influenced the behavior, this has influenced, the psyche of society and individuals. But here I want to make a comment that these two diseases, they are a little different. Like monkeypox, we know about the virus. This virus does not mutate as that much as the COVID virus mutates. And we have a vaccine which is effective, although supply is limited. And the potential of a spread or becoming a pandemic, that is very low at this moment. I mean, we should not get buried in that mode that we are going to witness something which we have witnessed with the COVID-2 last year or before that. So that is very unlikely situation. And as of
okay,
now,
Dr. Mishra, then a related question, because you say it's not that much of a scare as COVID. So what do we know about the incubation period, also the period of communicability of this disease?
Yeah, usually incubation period is 5 to 21 days. And most other cases take up between 6 to 13 days, but usually it's 5 to 21 days, the incubation period of this disease. As long as if they have skin rashes, there's a body fluid which is infected, yes, it can give rise. So when your rashes are dry up and the scab that is gone, till that time, yes, you can be infected. So usually it may be 4 weeks or more after development of the symptoms, and that's why we usually recommend that a person should be in quarantine at the current scenario for 21 days if they have the symptoms, so that we can stop the spread of the disease.
Okay, Dr. Barman, so the good thing is that it's not as big a scare as COVID. We've seen the worst times over the last 2 years, especially during the second wave of the pandemic. But when it comes to, taking precautions, what can common citizens do to protect themselves from this disease, which is spreading far more rapidly as expected?
Prevention is mainly like mainly avoiding of contact persons who is a suspected or a patient with the patient. This should be the you should avoid to contact with those people, person who is a suspected as well as known patients. This is the main important thing. And moreover, this is like if you wear a mask in these cases, because droplet infection, this is a droplet infection as well as airborne. So here droplet can be prevented with a mask. So if you use proper mask, and this can be prevented. Main things as already our colleague has already discussed about how it is transmitted. Basically, it's a sir has already mentioned, Dr. Asuk sir, Dr. Ganguly sir has already mentioned like he says like this is a commonly seen in MSM. Like there is the homosexual as well as men having sex with the man. Those people are very common with this. So you should avoid all those things, and more importantly is social education. I mean, education of the public. So this is more important. Awareness, more awareness about the disease and how the symptoms appear. Again, this is important to know by the public. So we should be aware to the public, like how the disease appear, how this is transferring. So this is less transferable than less transmissible than any other viral disease like previously, like smallpox. Smallpox is more transferable than this. So this is less transferable than less communicable than smallpox. So this is the prevention is mainly using mask and avoiding those social activities, which is already mentioned.
Okay, Professor Ganguly, one final question from you, because the cases have been rapidly rising in so many countries, and 4 cases have also been reported across India. This has certainly sent alarm bells ringing, prompting the center also to conduct a review meeting. But in the wake of the precautions that we are talking about, how can we reduce human-to-human transmission, and how can we prevent a major outbreak of monkeypox in a country as largely populated as ours?
So this is important again.
Professor Ganguly, the question is for you.
In 1918, we had stopped vaccination with smallpox. Those who have been vaccinated with smallpox are dead at risk. So there's a population which didn't get smallpox.
We seem to have lost the audio connection with Professor Ganguly, but I'll take the same question to Dr. Mishra. Dr. Mishra, so the good thing is that, as you rightly asserted in your previous answer, that it's not as big a scare as COVID pandemic, but looking at the precautions that one must take, and the fact that in order to prevent a major outbreak of monkeypox in a hugely populated country like ours, how can we reduce human-to-human transmission? And that's going to be a huge challenge.
Yes. The thing is that we know the mode of transmission. I said the droplet, the fomite, the close contact, right? So we have to avoid all these things. Wearing the mask is one thing, of course. The other thing is the surface should be kept clean. We should not come in the contact with those who are infected. If we come across those who are infected, we should go to the doctor so that those people can be quarantined, right? And we should minimize the contact. As far as the spread in many countries where it has been seen in those who are MSM or other people, what they feel is it is probably because of the body fluids and because of the close skin contact. So we should avoid, those kind of contacts if we suspect the disease. And mainly this is occurring in those individuals who have not got vaccinated for smallpox. So what I will say, those who are above 50 and got the smallpox vaccine, they are somehow protected. If not fully, yes, up to the large extent. Many of them, they might have the immunity which has waned, but many of them might have good immunity. So we should take all those precautions which are required. Again, I would like to repeat, use a mask, avoid the contaminated surfaces, and the close contact other people where you should suspect that yes, they might be infected or they have come in contact with certain individuals. And those who are susceptible, like healthcare professionals and others, they should be given the vaccine, and the government should purchase a vaccine from the countries where it is available and should be given to those who are taking care of such individuals who are infected.
Okay.
So that's how, and better surveillance system, that is of course is very important, a very good surveillance system, and
Absolutely.
all
So
these approaches.
these are the areas on which we need to be prepared absolutely to prevent a major outbreak. Professor Ganguly is back with us. Professor, one final question. We've been battered brutally by the COVID pandemic. It was an unprecedented health crisis before the world, and we suffered as did the world. Once again, we are faced with this global public health emergency. What are the lessons that we have learned from the COVID pandemic, and how prepared are we in dealing with such future health crises?
We have already put in 15 laboratories to track and do the surveillance, so the diagnosis becomes immediate. We have the prodromal symptoms. We have to be careful to have those prodromal symptoms. We need to get the drug over here so that those who get, they should be isolated, whether suspected or diagnosed and treated with drug. And we need to get some vaccine, as other countries have done. Those who have come in contact, they need to be vaccinated. So this is my last advice, and we need to also be very careful and put it at the root. The African countries, which are the origin of this particular.
Absolutely. As I said, precaution is better than cure, and with a host of precautions that our panelists have suggested, we must be extra careful because of this scare that has also now gripped India. 4 cases have been reported so far, 3 from Kerala, 1 from the national capital. And looking at how the situation is panning out across several countries, as many as 75 countries across the world, more than 16,000 cases as on date. It's important for all of us to remain extra vigilant, take necessary precautions, and if there are any symptoms that arise, we must consult the doctor. That having been said, I'll have to wind up the program. Thank you, gentlemen, for joining us on the program today, sharing your thoughts, your views with us and our viewers. Absolute pleasure having you all three on this edition of Perspective. So that's it from us on the program today. Thank you to you as well, viewers, for your time. Take good care of yourselves and keep watching Sansad TV.